This segment of Bridge Street is sponsored by St. Joseph's Health Cardiovascular Institute.
Checking your blood pressure is important whether you have it done at the doctor's office or you do it yourself at home, because if the numbers are high and you don't seek treatment, high blood pressure can be deadly.
But recently, some blood pressure drugs have been recalled. So what is a patient to do? Well, physician's assistant from Heart Health Academy, Andrea Atchison, joins us this morning with more. Good morning.
Good morning, ladies.
Thanks so much for joining us.
Thanks.
You know, blood pressure is an important thing. For some people, it's something that they have to do on a daily basis, right, to check.
Yes, they do.
And now there's sort of this recall. So what exactly happened?
So basically, we've been hearing a lot about this in the last several months. I don't know if you've noticed. I feel like every other week, my mom's sending me an email about some recall that she saw, and I'm like, thanks, Mom, for telling me. But it's just another one and another one. And don't forget that about 80 million Americans have high blood pressure. So this affects a ton of people.
Right.
And what it means is that just like any product, whether it's, you know, a kid's product or, you know, there's so many things, blood pressure pills can be recalled as well. And what the exact mechanism is, there are certain products that are in these certain drugs that are potentially carcinogenic, which means they can cause cancer.
Yeah. So then what happens? So if your drug has been recalled, you need to go to the doctor, I'm guessing, and get a different drug.
Correct. So what you don't want to do is just stop it on your own. That's very dangerous. You always want, because a lot of times you don't know if it's the right batch. There's different types of batches from the manufacturer that are affected. So maybe yours is, but maybe yours isn't.
Okay.
So you always want to, number one, know your medications, and we've talked about this in the past. Number two, you want to look and say, okay, is my drug affected? Just by the name, because the name's going to be in the article, and then call your doctor or your medical provider and say, hey, you know, I'm on this pill. Do I need to see you? What do I need to do? And let them determine what they're going to do, whether they're stopping it or switching it.
Now, what happens if you maybe are taking blood pressure medication, but you're not sure? You know, the first thing you said is don't stop taking it. Is that people who are taking it who aren't sure, should they just go and see their doctor? I mean, is that the best
Absolutely.
protocol?
You never want to second guess, you know, yourself, or I should say guess yourself, because you just don't know, and you shouldn't know about these details of these recalls. So always ask, always call up, and don't wait like 2 months, because what if yours is the affected product? You don't want to be taking something that's not appropriate, and there's so many other choices out there that the doctors could switch to, you know, for substitution.
Well, and so what you're also saying is don't just get off of it and think, you know what, I'm just going to do all the things that I need to do. Go exercise, eat better, because I don't even want to be on this medication at all anyway.
Exactly,
So
and that is certainly a possibility. So you guys know that with my mission, I try to prevent people from having to take these in the first place or getting off of them, but you have to do it in the right manner. You know, maybe your pill needs to be weaned down or tapered, if you will. They could be dangerous if you just stop at cold turkey and all of a sudden your blood pressure shoots up, and then you could be at risk for like a stroke or a heart attack.
So I was going to say, what are some of the things that you can do, I mean, that you do personally to help people get their blood pressure down? And
that's a great question. So the main thing that I love to do is get people eating healthier. I find that most of my clients are not eating a well-balanced diet. They're eating the wrong foods. They're eating the processed foods. So by eliminating a lot of the junk, if you will, and it's not an easy process, right? It takes a long time.
It does.
But there are studies out there that say, you know, if you eat healthier, again, that's a generic term, you can lower your blood pressure and you can get off some of these medications. So I'm a huge proponent of just getting off of them and just making sure that they're safe if you are on them or have to take them.
Yeah.
Well, maybe this is a great kickstart for people who are maybe on a medication that has been recalled. Go see your doctor and then maybe, you know, meet up with you and hopefully try to wean yourself off.
Absolutely.
Right?
And I always do that with the discretion of their doctor as well.
Right. There we go.
Yeah.
Well, listen, you can connect with Andrea and find out how she might be able to help you. Just visit her website, thehearthealthacademy.com, or you can find her on Facebook as well. Thank you so much.
Thank you.
You're welcome.
Thank you.
Thank you.